I hope you were all here for the ObamaCare panel because that's what we're here to talk about. We're going to give you a little bit of an overview of the healthcare system and when Obamacare was passed and why and what's wrong with it, and we're going to talk about some of the legal challenges as well that are have gone through the court system and that are still pending in the courts as well. But before we get started, I'd just like to take a minute. You've heard from two of our panelists at least already. But we're going to have a 1-minute introduction. I'll be the moderator today and add my 2 cents where I think I might have something to add. And but these gentlemen are the ones that are going to really add the substance, give you the substance about Obamacare. So if we can start with Dr. Torres. Do you want to introduce yourself?
Yeah, hi everybody, thank you for coming. My name is Juan Torres. I am a doctor, work here in Orlando. I am infectious diseases specialist. I was born in Ecuador, South America, and I came here in the 80s to practice medicine in the country that was my dream since I was a child. To be honest, I was paralyzed when I was 14, and at that time I decided to be a physician, and I decided to practice medicine in the United States because I heard that this is the best country in the world. So my dream was to come here, and I did it. And I established my practice in Orlando more than 10 years ago. And I'm involved with doing these kind of things now because I think the medicine is going the wrong direction. It's very difficult to know what's going on in the medical field unless you practice medicine, you walk in the hospital and see the patients every day. One thing is what you hear in the news. Another thing is what happened in the hospital. And hopefully I can clarify some doubts and questions that you might have so you get a better informed about the situation we're living now.
Right, and we'll definitely have a question and answer session at the end. So if you have any questions, write it down or just make sure that you remember because we're going to try and devote at least 15 minutes at the end of our session to any questions that you have about Obamacare and how it might affect you and your doctors. Dr. Moore?
Is this on?
Mm-hmm. Yep.
Okay. My name is Tim Moore. I'm a practicing heart surgeon. I've been practicing in Central Florida for 20 years. And in Central Florida, our patients are quite elderly compared to the rest of the nation, so the vast majority of my patients are Medicare. So I have a very long history of working with the government healthcare system as we know it for our patients in the Medicare system. And it's been a concern of mine for many years because that system has been readily becoming insolvent, and we now have the worst possible solution about to be added into the mix. And my background in terms of my training was general surgery in Boston at the Mass General, which has of course been in the news this week, and cardiac surgery training at Emory in Atlanta before moving to Central Florida back in 1993.
This is Harry Mihet.
Hey guys, thanks for joining us this afternoon. I am Harry Mihet. I'm Senior Litigation Counsel at Liberty Counsel. It is our privilege to be involved in the front lines in the legal fight against Obamacare, and I hope to be able to discuss that lawsuit with you here today. If you were here last night and you heard my testimony, then you know that I also had some experience with Obamacare before it was repackaged by President Obama and sold as Obamacare. I experienced universal health care in Romania, where the government came in and took over the healthcare system, drove it into the ground, and appointed itself in charge to tell people when they could see a doctor and what doctor they could see and what services they could receive from the doctors. So we hope to prevent that day from coming upon us here in the United States. And again, we thank you for being here with us.
And my name is Mandy Campbell. I am litigation counsel with Liberty Counsel. I just joined the Lynchburg litigation team about a month ago, but before that, I was managing our Washington, D.C. office and doing public policy actually while Obamacare was shoved through Congress. So hopefully we'll get to share a little bit about policy, a little bit about the legislative process, and a little bit about both litigation and our healthcare system. And actually, the healthcare system is what we're going to start out with, try and provide a solid foundation of how we got to where we are with Obamacare and how Congress was able to frame a need for something like Obamacare. And Dr. Moore is going to give us a little bit on that.
What I'd like to do is take you through the evolution of government health care in the United States and how we got to the point we were before Obamacare was passed, how much trouble our system was in prior to that point, and then show you again why Obamacare is the absolute worst possible solution to add into this problem. Next slide, please. As Winston Churchill said, the main qualification for political office is the ability to foretell what is going to happen tomorrow, next week, next month, and next year, and to have the ability afterwards to explain why it didn't happen. And that's exactly what has happened with government health care as it was started with Medicare. Next slide, please. Medicare, the original premiums that they promised us were going to be $3 a month, and the average outlay from the federal government was going to be about $500 million a year from general tax revenues. Well, that didn't sound too bad when they passed it in 1965. Next. When Medicare was passed in 65, they realized that it was ultimately going to cost more than that, and they projected that by 1990, the cost of Medicare would be $9 billion. Well, what happened? By the time 1990 rolled around, the actual cost was over 10 times that, $110 billion. And by 2012, the cost was 50 times that, now $555 billion, and add in another $250 billion a year for Medicaid. So $750 billion is a long and far cry from the original $500 million that they told us it was going to cost when they passed it. Next. Medicare is going broke. Medicare is in far worse shape than the Social Security system. Medicare has an unfunded liability of 3 times that of Social Security. There are 2 good sources of information if you want to actually study this, and they come from the government itself. The first is the annual Medicare Trustees Report, which is put out each year, and this is an analysis of the cost projections of Medicare. Unfortunately, these actuaries that sign this report realize that what they are projecting is based on the numbers provided them by the administration, which bear no relationship to the truth. And so they have to publish an alternative scenario to show you what's really going to happen, and you have to search for that. So the Medicare Annual Trustees Report and the alternative scenario, which shows you what the truth really is. Well, they've already announced that the Medicare expenditures began to exceed revenues back in 2008, and that the Medicare Trust Fund is going to be exhausted out of money in 2024, which is 5 years earlier than the 2010 estimate. The analysis and projections keep getting worse from year to year. Next. Why is this? 2 major reasons. The first is demographic. We have an aging society. We have baby boomers that are retiring. We have people that are living longer than ever before. When Medicare was passed, your average life expectancy was less than 70 years. So you would go on Medicare at 65, you'd be dead before you were 70. Now our average life expectancy is about 80. People are living longer, and they're utilizing more health care. They're surviving their heart attack, to develop lung cancer, to survive that, to have a stroke. Over 20 years after beginning Medicare. And what we see here is the increase in the number of people that are paying into the Medicare system, the workers, and the number of people receiving Medicare, the beneficiaries, which are far outstripping the number of people that are paying into the system and will be paying into the system. Now then, the second reason that Medicare is going broke, one of the major reasons, is technology. When Medicare was passed in 1965, we simply did not have anywhere near the amount of technology that we do now. I mean, now we've got PET scans and MRI scans and CT scans and heart transplants and brain transplants and everything that we just didn't have back in 1965. What you need to explain to people when they ask you, why is health care cost so much? The reason that health care costs so much is it's expensive. That's the answer. Okay? If you want to go back to 1965 prices with health care, you're going to have to go back to 1965 health care. Next. And here's what's really, really shocking. If you look here at this first column, all right, the middle gray bar there, if you are an average wage earner married to a low wage earner, you will take 5 times the amount of money out of Medicare that you paid into it. So everybody says, well, I've been paying into Medicare all my life. I deserve to get my health care. Yes, but you and your spouse are going to take 5 times the amount of money out of Medicare that you paid into it. So the system is really unsustainable. Next.
I think that's actually a good point, Dr. Moore, too, and it's that the people that are taking Medicare or that use Medicare insurance, it's not a problem with those individuals. We talk about these things as entitlements, but in actuality, you paid into these programs, you paid into Social Security. So the problem isn't with the individuals that are using Medicare as their insurance. The problem is with the government when they created this program that's unsustainable because they weren't actually able to estimate the cost. They didn't know about these tests that were going to be created that are going to be life-saving, but they're also going to cost a lot more than the tests that were readily available when Medicare was created.
And here's your federal budget. And if you look, the square up here on the left, the very largest, biggest square up there is the Center for Medicare and Medicaid Services, which far exceeds the size of the Social Security Administration, which is the box which is below that, and of course is much bigger than the box to the immediate right of that, which is your national defense budget. So it's the largest single drain on our federal budget. Next. So this is the amount of money that hospitals are losing taking care of Medicare patients. Medicare does not cover the cost of actually taking care of Medicare patients. And you can see that starting back in 1997, it was sort of a break-even proposition. And as you go forward into the 2000s, the hospitals are losing more and more and more money on Medicare and Medicaid. Next. Currently, Medicare only really provides a hospital about 90% of what it takes to take care of a Medicare patient. So the hospitals are 10% negative on their Medicare patients across the board. Next. But that's going to get worse. By 2019, it's going to be 15% negative, 25% negative by 2030, and 40% negative by 2050. Hospitals are going broke taking care of Medicare patients. Next. Well, what about physicians? All right, this is what happens with the physician reimbursement. You can see in the blue line, starting in 2001, the enormous drop in Medicare reimbursement for physicians, but the cost of running our practices continues to escalate way beyond that of inflation. Next. So currently, Medicare only reimburses hospitals and physicians at a level of about 80% of what private insurance pays. But that's going to get worse. In 20 years, it's going to be half of that. It's going to be 40% of what private insurance pays. And this Medicare trustees report that I was telling you about, the alternative scenario, what's really going to happen, they know this is not sustainable because we're scheduled to get another 30% cut at any moment, which keeps getting delayed by Congress on a month-by-month basis. Next. All right, so this is an unsustainable situation. You have a Medicare trust fund that's going to go broke. You have hospitals that are going broke. You have physicians that are going broke. The system is out of money. It's the largest single expense in our federal budget. That's before Obamacare was even passed. And the cost projections for Medicare, as we showed, went 50 times what they originally estimated it was going to be. Next. So, fool me twice. Let's look at what's going to happen now with Obamacare, which was passed into law into 2010. And we're going to look at the 5 promises of Obamacare. Next. Promise number 1, Obamacare is going to reduce the deficit. Somehow we're going to manage to provide health care to all these people in a system that's already bankrupt, and we're not going to lose any more money, right? President Obama says, but it is a cost that will not, I repeat, will not add to our deficits. I've set down a rule for my staff, for my team, and I've said this to Congress, health care reform must be and will be deficit neutral in the next decade. Next. Well, the original cost of Obamacare was $950 billion. The Congressional Budget Office estimated in February that it's over double that, $1,900 billion, right? And so they're going to try to offset this with a whole lot of new taxes and premiums. But one of the concepts I want you to remember is that corporations and insurance companies don't pay taxes. They basically are turned into tax collectors for the government. Individuals pay taxes. So when Obamacare puts all these taxes on medical devices, insurance companies, and employers and all that, that gets passed down to the individual in terms of either increased prices or reduced wages. Next. So the cost of Obamacare has gone from $900 billion to $1,900 billion before it's even started. They haven't even started Obamacare, and now it's already doubled in cost. Next. Promise number 2, Medicare will be protected. Well, we all know that it was Paul Ryan that was pushing grandma over the cliff, right? He was the one that was going to destroy Medicare. Next. Back up one. Obamacare takes $716 billion out of Medicare to pay for itself. So this bankrupt, financially insolvent government health program that we know as Medicare is going to be robbed of another $716 billion to pay for Obamacare.
Right, and that's actually in spite of a 3.8% Medicare tax on things like the sale of a home, a townhome, and income from rental properties as well.
Next. So this is what happens with Medicare reimbursements for hospitals. The projection, according to the Medicare trustees, and you can see there was an increase in around the time of 2000, a steadily drop off for the next decade, and it continues to get worse and worse. And look at how far below the dotted line of regular private health insurance that is. Next. Look at physicians. Same thing, fell off the cliff right there in 2010, continues to decline steadily over the next decades. And what's worse for physicians is that the Medicare reimbursement actually falls way below Medicaid. And we'll talk just about that in a second. Both of those are far below what private health care insurance provides. Next. So what they're going to do is they're going to shift a lot of patients into Medicaid. You may have heard even here in the state of Florida where Governor Scott was trying to increase the Medicaid abilities of the state under Obamacare. But Medicaid pays far worse than Medicare. So if we talked about how badly Medicare pays and doesn't cover costs, Medicaid is far worse than that.
And even talking about the cost of the insurance or the cost to the doctors, it's not just a cost in like a financial cost, but it's also a cost of time, right? I hear that there's a lot of bureaucracy, a lot of paperwork involved in these types of programs for doctors. Is that right?
Oh, yes. I mean, there's going to be all kinds of layers of people to administer this. In many states, Medicaid is the largest item on the state budget, and states are struggling under the burden of Medicaid, and now they're going to add all these new people into Medicaid. Next. This is the state of Florida. Remember we said that Medicare currently pays 90% of what it costs to actually care for a Medicare patient? Well, Medicaid only pays around 70% of what Medicare pays. And you can see down there in the state of Florida on the lower right is the yellow state. In Florida, Medicaid pays less than 70% of Medicare, which only pays 90% of what it costs to actually take care of a Medicare patient. Next. Promise number 3, you can keep your health insurance. Well, our leader said if you like your health care plan, you'll be able to keep your health care plan, period. Excuse me.
It's Medicare.
Yeah.
Just as a side note as well, right now Medicaid covers folks that are at 100% of the poverty line, and Obamacare takes that up to 133% of the poverty line, which means that there's going to be a lot bigger pool of people that are trying to access Medicaid.
So if you like your health care plan, you'll be able to keep your health care plan, period. If you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance. This law will only make it more secure and more affordable. Next. We know that employers are going to be dropping coverage. The Congressional Budget Office, our own government, states that 8 million people are going to lose coverage as of February. Next. Children are going to lose coverage. The Internal Revenue Service has decided that employers, to meet their requirements and their mandate, must provide health care insurance for the individual, but they don't have to pay for families. So they're going to provide you with your health care insurance, but they don't have to provide coverage for the families and for the children. And the insurers have been dropping children-only insurance policies by like flies because of the increased cost for that. Next. Seniors are going to lose coverage because physicians aren't going to be able to take care of them with the Medicare reimbursement cuts. And right now, as it stands, 1 in 3 doctors won't even take Medicaid, and we've already talked about how many more patients are going to be added into Medicaid. Next. Promise number 4, insurance will be more affordable. President Obama says, I have made a solemn pledge that I will sign a universal health care bill into law by the end of my first term as president. It will cover every American and cut the cost of a typical family's premiums by up to $2,500 a year. Next. Well, just last month, Kathleen Sebelius finally said, well, you know, actually costs probably will go up. She said that these folks will be moving into their first fully insured product for the first time, and so the cost may rise. Next. And the Obama administration itself, issued instructions to its spokespeople saying that they should no longer make promises that health care is going to be affordable. The message that consumers will be able to get health insurance that will fit their budgets is highly motivational but not believable. That's just from last month from the administration itself. Next. The Society of Actuaries says that the average cost increase for private insurance policies will be 32%. Next.
Right, and even when the bill was passed, the Congressional Budget Office told us that it was going to be at least an increase of 10 to 13%. So we're seeing 3 times that in actuality.
Right. The state societies have done their own studies showing increases anywhere from 30 to 80%. Next. Go ahead, we'll skip this. Next. The last promise of Obamacare that no one making less than $250,000 will see their taxes go up. He said, I can make a firm pledge. Under my plan, no family making less than $250,000 a year will see any form of tax increase, not your income tax, not your payroll tax, not your capital gains tax, not any of your taxes. Next. This is the list of the Obamacare taxes. All right, and many of these do directly affect you as individuals. Many are passed on to you through other intermediaries. Take, for example, the device tax. There's a tax on all the companies that make medical devices. That's going to get passed on. Even when you take Rover and Fluffy to the veterinarian, you're going to be paying for the devices that are made by the medical device companies that the veterinarians use. Even the devil himself couldn't have thought that one up. Next. Obvious adverse effects on the economy that we're seeing, employers reducing hiring, switching people to part-time, and physicians dropping out of the workforce. Next. That's your current healthcare system.
What a mess.
I'm sorry, I can't remember where I actually stole that slide, but that's how complicated things now are under Obama. And you can see that the physicians are in the very lower left-hand corner, the patients are in the lower right-hand corner, and the central portion of this is your Secretary of Health and Human Services, and this is what is the most frightening thing about Obamacare.
Right, and I think that we're going to talk a little bit more about that with Harry, too, HHS, and what they're doing to help your health care.
Next. That the really frightening thing about this is government regulation without representation. You now have people that you did not elect who are in charge of your health care. The IRS has decided that employers don't have to cover families. The IRS has decided that even if your state does not establish an exchange, that you will be subject to penalties and mandates and subsidies. Next. And then finally, the last slide, the Independent Payment Advisory Board. In the past, all the decisions about Medicare funding, government health care funding, have been made by your elected people in Congress. That is no longer true. The Independent Payment Advisory Board, as established by Obamacare, is a panel of presidentially appointed members in the executive branch who are charged with reducing the cost of Medicare. So no longer are the decisions about the prices and cost and treatments going to be made through the elected officials in Congress. They're going to be made by the executive branch, by presidentially appointed members of this board whose only job is to further cut Medicare and other health care costs. So thank you very much.
Bureaucrats. So we've talked a little bit about the system, and we've seen these parallels already between Medicare and Obamacare. We know that Medicare is supposed to be bankrupt in less than 9 years at this point, and we are already seeing the parallels, and that Obamacare is going to be headed in the same direction. So we know that this is definitely unsustainable, and we know that there are definitely people on the front lines continuing to challenge Obamacare and its constitutionality, and that's what we want to talk to Harry a little bit about. So Harry, tell us a little bit about religious liberty. Does Obamacare threaten religious liberty?
It absolutely does. Obamacare, despite what you may have heard, is the single largest government funding of abortion in our nation's history. Obamacare funds abortion to an unprecedented extent by requiring employers to provide cost-free coverage to their employees, not only of contraceptives, not only of sterilization procedures, but of drugs whose design and purpose and effect is to cause an abortion, to end life after it has been formed and created by God. The Obamacare law also requires insurers to collect at least $1 a month from every man, woman, and child enrolled in insurance coverage, specifically to cover elective abortion. That means if you have insurance, and if you pay an insurance premium, $1 a month at least will go to cover elective abortions.
Wait, and that's just people that want abortion coverage, right?
That's right. That's
No.
that's basically everybody, every man, woman, and child. It doesn't matter what your religious convictions are. It doesn't matter when you believe that human life begins, and whether you believe that only God has the ability to take human life. If you are covered by a health program under Obamacare, you will be directly funding abortion.
But I heard something about an executive order that's going to prevent abortion coverage in Obamacare.
Yeah, right. President Obama said a lot of things to get his signature legislation passed. And then after it was passed, he said a lot of things to try to quell the rebellion that his program was causing. And one of those things, you may have heard him, this executive order, no public funding of abortion. Well, you also know that Nancy Pelosi famously asserted that you've got to pass the bill before you know what's in the bill. And actually, I don't think even she knew how right she was about that, because although it's over 2,000 pages long, it will literally stack up about this high. Obamacare only deals with things, the law itself only deals with things in broad generalities. For example, the law mandates employers to provide, quote, minimum essential coverage, which was defined in the law to include preventive care services. What is preventive care services? Well, the law that was passed doesn't say. Instead, after the law was passed, Health and Human Services, HHS, comes in and says that preventive care services basically means, quote, measures shown to decrease the likelihood or to delay the onset of a condition. Well, what's a condition? Cancer is a condition. Diabetes is a condition. According to HHS, pregnancy is a condition as well. And so anything that delays or prohibits or destroys a pregnancy would be preventive care services under Obamacare. And so as a result, you have this mandate that not only sterilization and contraceptives be provided, but actually abortion-inducing drugs or abortifacients are mandatory required. And then you also obviously have the abortion mandate premium that requires that $1 a month that we talked about. So make no mistake about it, regardless of what President Obama or Nancy Pelosi might have said or might still try to say, Obamacare is the single largest government funding of abortion program in our nation's history. It's unconscionable that we would pay over $300 million a year to Planned Parenthood in the face of a national deficit or debt that's approaching $17 trillion. Obamacare will make the government funding of Planned Parenthood look like a drop in the bucket in terms of using your money, your tax dollars, to fund abortion.
All in the name of preventive care services and family planning. They make things sound so pretty and it's so deceptive. But not only does Obamacare cover abortion, but you've heard of these death panels. I think it was Sarah Palin who talked about the death panels, the rationing of care. You've heard about assisted suicide. Maybe you haven't heard, but the federal government can be funding assisted suicide in states where that's already legal. So in states like Oregon and Washington, we're talking about life. Well, we appreciate life on every end of the spectrum, whether it's at conception conception to natural death. And our government shouldn't be funding assisted suicide, and that's exactly what Obamacare is set up to do. We also have, like I mentioned, the rationing of services for cost effectiveness. We've talked about this bureaucracy and how inadequate it is, especially, we talk about the DMV. Who likes to go to the DMV? And this is our health care. The government is going to be providing our health care insurance. So it's just crazy. But regarding abortion and regarding the coverage of abortion and these $1 contributions and things like that, at least isn't there an accommodation for faith-based organizations like Liberty Counsel and some of these other great organizations that are represented here at these exhibit booths that have a moral objection?
Well, again, if you listen to what the Obama administration says, oh, don't worry about it. Faith-based organizations are going to be exempt from funding abortion directly. Well, again, the devil is in the details. And although the law purports to exempt, quote, religious employers from funding abortion directly, the law defines, actually not the law, the regulations passed by HHS after the law was enacted, defines religious employers so narrowly that only churches, houses of worship themselves would be exempt. Any other Christian organization or nonprofit organization like Catholic charities, Catholic hospitals or Christian hospitals, Christian bookstores, any other Christian or nonprofit charity would not be exempted from this requirement. Moreover, any for-profit company that happens to be run by Christians according to Christian principles, they're run by the book, so to speak, would certainly not be included in that exemption. And so then you have companies like Hobby Lobby. How many of you have heard of the pickle that Hobby Lobby finds itself in now, where they're facing tens of thousands, even millions of dollars of fines per day or per month because they have drawn the line in the sand and they have said, we may be for profit, but we are still followers of Christ and his teachings. What Obamacare does is it requires business people, entrepreneurs, to basically check their faith at the door of the marketplace, and that's the cost of doing business. You can have your beliefs, but if you're going to participate in the capitalistic marketplace, you better leave those beliefs at home. So, yeah, in theory, we have exemptions. In practice, they mean absolutely nothing.
So it sounds like this is the most transparent administration in the history of our country.
That's certainly what we were promised.
These promises seem so empty these days. Tell us more about this compromise.
Well, so there has been a lot of backlash against the administration for requiring people of faith and organizations of faith to fund abortion. And so the next solution was this grand bargain or compromise that you may have heard about, where the president comes and says that he's got an idea or a solution to allow eligible organizations to opt out of these provisions. Again, what's an eligible organization? Well, we don't know yet, but they'll tell us when they figure it out. More importantly, here's what this compromise involves. Basically, if you are an eligible organization, you tell an employer, you tell your insurer, the company that's providing the insurance, hey, I don't want to fund contraceptive coverage and abortion coverage. The insurer looks at you and says, okay, fine, you don't have to pay for it. But the law still requires the insurer to provide those same exact services to the insured. Okay? So the employer's not paying for it, but they're still required to provide them. Who pays for it? Well, in theory, the insurer gets stuck with the bill, but if anyone here thinks that the insurance company is just going to absorb the cost, I think we are all too wise to know that is going to happen. The insurer is just going to increase all of the other rates and premiums in order to make up for the loss. Incidentally, how many of you have heard or know that Obamacare actually caps the profit that an insurance company can make to 15%. The law says if you're an insurance company, you cannot make more than 15% profit. Have you heard that? I mean, if that's not socialism or communism, nothing else is. Incidentally, the law doesn't cap the loss that an insurance company can suffer. So you're exposed to an unlimited loss. If you make more than 15% profit, you have to disgorge, you have to reimburse your insureds with that money. And now, on top of that, you are saddled with this abortion cost that you can't charge the employer for, but that you have to handle. I think we all know that the ultimate goal of Obamacare is to drive private insurance companies into the ground, and then the only solution will be what? Single-funded payer, government-controlled, government-mandated health care, and that's the ultimate goal here.
So we've heard the parade of horribles. I think most of the folks in this room probably had a little bit of an idea, at least, of how terrible Obamacare was already. But what is Liberty? Give us some hope. What's Liberty Counsel doing about it?
Well, here's the good news. Liberty Counsel, on the day that this horrible piece of legislation was signed, the ink was not even dried on the president's desk yet. Liberty Counsel was in court to file a lawsuit to challenge the constitutionality of the law. It is the most comprehensive lawsuit to date against Obamacare, the most procedurally advanced lawsuit, and a lawsuit that we are very hopeful will right this great national wrong.
But there was a case that was decided by the Supreme Court, and normally when an issue is decided by the Supreme Court, it's a dead issue. So what's different about Liberty Counsel's lawsuit than the decision that we heard in the summer?
Right. We all know that last summer the Supreme Court, with Chief Justice Roberts, gave us all a great disappointment by upholding the individual mandate portion of Obamacare. That decision, as bad as it was, did not foreclose additional challenges to Obamacare. It concerned only the individual mandate and only the constitutionality of the mandate under the Commerce Clause or the Tax and Spend Clause, not under the religious, the free exercise of religion or the Establishment Clauses. So our lawsuit now addresses not only the individual mandate from the free exercise of religion perspective, but also the employer mandate, all these abortion and contraceptive mandates. They are all addressed in our lawsuit, and they have never been addressed by the Supreme Court. So the door is still wide open. In fact, the Supreme Court actually opened the door to these additional challenges. When we were at the Fourth Circuit Court of Appeals with our lawsuit, the Fourth Circuit Court of Appeals shut the door on us and sent us away saying, hey, Obamacare is a tax, and the Anti-Injunction Act is a federal law that says you cannot challenge a tax until you've paid it, you've been forced to pay it. And so since the law doesn't come into effect until 2014, you have no standing, and the court sent us home. Well, the Supreme Court, Chief Justice Roberts did one good thing and said, well, no, it's not a tax for purposes of the Anti-Injunction Act, and so it therefore opened up the door. It corrected our Fourth Circuit Court of Appeals so that we can go forward with our challenge.
So it wasn't a tax for the year, 2 years that they were debating this in Congress. I can't even tell you how many times when I was in D.C., heard congressmen tell their constituents that it's not a tax. Obama said it's not a tax, it's not a tax, it's not a tax, but it's a tax.
Well, it depends, Mandy. It's not a tax for purposes of the Anti-Injunction Act, but it is a tax for purposes of the Commerce Clause analysis.
This sounds a little bit convoluted and maybe a little bit like judicial activism.
Well, yeah, of course. I mean, it's not a tax if President Obama doesn't want it to be a tax, but it is if he wants it to be a tax. It's a classic example of result-driven decision-making at the Supreme Court. They had the result in mind where they needed to get to, and they were determined to move whatever obstacles they needed to move in terms of the law and the Constitution to arrive at that result. Classic example, same thing happened to abortion with Roe v. Wade, where the court just found this fundamental right to an abortion in the penumbra, in the shadow of the Constitution, with the right to privacy.
So you've told us a little bit about what makes Liberty Counsel's case different from the others. Can we, we're running a little bit low on time, and I want to make sure we get through what the arguments of Liberty Counsel's case are so that we can have a better idea of what the challenge is about.
Sure. With respect to the employer mandate, we are arguing that the employer mandate is not a constitutional exercise under the Commerce Clause powers of Congress. That argument has actually already been made and decided for us. Chief Justice Roberts said that the individual mandate is not a constitutional exercise of the Commerce Clause powers, and so that same rationale applies to the employer mandate. We're also arguing that the employer mandate is not a lawful exercise of the taxing power of Congress, and we're using Chief Justice Roberts' own arguments and theories to make that case. He decided that the individual mandate was a proper taxation power of government because $2,000 or $3,000 a year, however much the penalty works out to be if you don't buy insurance, he said it was not so high that it would destroy individuals, that it would debilitate them. Well, the employer mandate is so high that it would certainly drive employers into the ground. You're talking about $2,000 or $3,000 per employee if you don't provide the minimum essential coverage that you're required to provide. When you have an entity like Liberty University, which is, by the way, our chief client in our lawsuit, and they employ 6,900 individuals, if you do the math, you're talking about tens of millions of dollars. And under Chief Justice Roberts' own theory here, that is certainly a debilitating tax, and so therefore it does not survive the taxing power of Congress analysis. More importantly, if the mandates are in fact taxes, then they are also unconstitutional because the Constitution says that all tax bills must originate where? In the House of Representatives. Where did Obamacare originate? Well, again, more shenanigans here. We all know it originated in the Senate with its principal sponsor, Harry Reid. Now, Harry Reid apparently had read the provision in the Constitution that said that tax bill must originate in the House. So what did he do? He took a House bill that was intended to provide home buying exemptions for veterans. Okay, that's related to healthcare, right? He completely gutted that bill. He crossed out every single word in that bill, but kept the designation as a House bill. And then he put on top of it 2,000 pages of Obamacare. Okay, so if you ask him, where did Obamacare originate? He'll say, well, clearly it originated in the House. It's House Bill so-and-so. Well, these are more shenanigans, and we're bringing the court's attention to this and asking the court not to entertain these kinds of constitutional gymnastics. And so finally, the chief argument we have, obviously, is that it violates the constitutional guarantees of free exercise of religion. It violates the Establishment Clause. It violates the religious, all kinds of laws that Congress has passed to require people of faith to support with their money and with their dollars something that they find to be morally abhorrent. That's the argument that has never made it to the Supreme Court, and I think that's the argument that will eventually carry the day. We hope so.
So where is the case right now, and where will it go from here?
So as I said, there are a lot of cases that are percolating around still in the lower courts. Our case was already at the Fourth Circuit Court of Appeal when the Supreme Court decided its case, and so when it opened the gates for us to go forward, we were already at a pretty advanced stage. So we have one more reply brief to file with the Fourth Circuit Court of Appeals in Virginia this month. We're going to have oral arguments next month in May, and then hopefully a decision sometime by the end of the summer or sometime this fall.
And then no matter what's decided this summer or fall, we know that eventually.
Yeah, this is most likely another trip to the Supreme Court. I mean, regardless of which side wins in the lower court, the Supreme Court, I think, will want to have the last word on this. Already, there are different decisions in the lower courts. Some courts are saying, oh, there's no problem with the mandate requiring people of faith to fund abortions. Others are saying, yes, there is a big problem with that. It's unconstitutional. Clearly, you cannot have different standards apply in different parts of the country. This is going back up to the Supreme Court to reconcile that decision. And so the final chapter on Obamacare has not yet been written.
So we have a long way to go in litigation, to say the least, especially with it going back up to the Supreme Court. What can these folks do? I know that we heard Jim Bob Duggar this morning talk about getting involved in politics by running for office. Maybe we have some folks in here that'll eventually run for office, maybe federal office, and they'll get in there and they'll drop their own bills to repeal different provisions in Obamacare. But what else can folks do to get involved in this process?
Well, I'd say partner with us and with others who are fighting in this fight. Pray for us. We covet and we need your prayers. As you've just said, this is a battle that's beyond our human abilities. Pray for us. Pray for the court. Pray for Chief Justice Roberts. I've been watching his decisions since last summer, and he's got a lot to atone for. He's got a lot of lost ground to make up. But I have seen some decisions, including one that he made this week, that give me hope that he is still a conservative at heart. And however misguided he was in his initial decision, I have to believe and to hope that if given the chance, he will right this wrong.
So we know that Obamacare is fiscally in ruins already, and it's really not even gone into effect yet. We've had a few taxes go into effect, but that's essentially it. And then we know that it's unconstitutional, and so we have a lot of court battles that folks are engaging in to try and fight the bill because of that. But I wanted to hear a personal story from Dr. Torres. This bill isn't just some bill that passed in Washington, D.C., isn't really going to affect the everyday lives of Americans. It's actually going to have a huge impact on everyday Americans and their health care. And so I wanted to hear Dr. Torres talk a little bit about his experience as a healthcare provider, but also about patient accessibility and what healthcare is going to look like for each of us as we try and make appointments to go to the doctor.
Thank you very much, and great for these two reviews. I really don't know how to call Obamacare. The longer I read about it, the more patients I see. I think I'm running out of different terms to call it. What I want to do now is go over some specific cases about what I see in the hospital and tell you a little bit about my personal experience with Obamacare. As I say in the beginning, one thing is what we read and what we hear. Another thing is what we see in the hospital. Let me start with this idea that Obamacare will not influence or have anything to do with you doctors. In the United States, traditionally about 2/3 of the medical practices has been private practices. And that has been for decades. And that's changing a lot. Why? Because doctors are selling the practices. And you have to understand why it is happening. Remember that this administration doesn't believe in anything that have the word private. And this is private medicine. The reason doctors are selling the practices is because we are getting hit by 3 different angles. Number one, regulations. Every day is getting more and more difficult to open any kind of business or open any kind of practice. Number two, the reimbursement. It's very, very difficult to work, keep your overhead running, take care of your employees, benefits, salaries, everything. If your reimbursement goes down and down, it's not going to happen. And number three, taxation. Just imagine you have your business or any kind of work, and out of the blue, the government says, okay, beginning this date, we're going to increase your taxes, you're going to be regulated more, and not only that, but we're going to pay you more, less, a lot less. I never imagined that this would happen in the United States. This is the last country in the world. And I can tell you that from the bottom of my heart because I came from a third world country where you see these kind of things, but not in the United States. When rumors start going around that this is going to happen here and there, I said, no, I gave it the benefit of the doubt. I said, no, it probably is not that bad. It is a lot worse than what you think. The first thing that I heard was that the government decided to decrease the reimbursement for outpatient procedures, outpatient diagnostic tests, somewhere between 35–40%. And some of my friends, my doctor friends said, you know what, I don't know what's going to happen now. Because we have, 30 employees, 50 employees. There's no way I can afford my practice anymore. I need to take care not only of my patients, but I need to take care of my employees. So doctors decide to let people go. And one of the reasons the unemployment got really bad was because there were thousands of people all over the country that lost their jobs from private practice. And things were getting worse and worse. Remember something. Never believe anything the government say in terms of estimation. When Medicare and Medicare were created in the 60s, they told us that it's going to cost this amount of money. Each one costs more than 7 times of the predicted amount. ObamaCare already is costing a lot more money when haven't even started fully. It's not just a threat for patients and doctors and citizens. It is a sad reality with us already. I want to give you some specific examples so you know what's going on in your own city. I don't know how many of you have Medicare, Medicaid, or private insurance. But if you have a patient that comes to the hospital, let's say patient A, with this specific disease and require this specific treatment, and that patient has Medicare or Medicaid. On the other side, you have somebody, patient B, who comes to the hospital with the same disease and requires the same treatment. You don't hear this because this is not part of the typical conversation between a doctor and a patient. But this is what we do in the hospital. If you have Medicare or Medicaid, we call social worker because we want to make sure that what you need can be afforded, that is approved, that is not denied. So social worker person assigned for that specific floor come and say, I don't think the patient can go home like that. You need to choose something else. Something else? But that something else might be cheaper and maybe not that effective as compared with the first one. And say, yeah, but it's not going to go home with that. Sorry. So we say, okay, we have to review the case and see if we can find another alternative. And remember, we tend to choose the best thing for obvious reasons. Also because these days we practice a very defensive medicine. Doctors get sued right and left for no reason many times. Many times. I say no always because mistakes happened. So when social worker comes and say, that's not an option, we go to option B. If option B is not an option, we go to number C, option C. By that time, the patient already stay in the hospital 2 or 3 days more because we cannot find what might be the best option for you because of this Medicare and Medicaid situation. That's with patient A. Now, patient B here has a private insurance. If you're lucky enough to have a private insurance, we don't call social worker. Social workers have no role in that case. We give you a prescription, and we say goodbye. I see you in the office in about 7 days or 10 days. You're out of the door. Medicare, and I'm telling you this because you need to know that Medicare and Medicaid deny medications, diagnostic tests, and procedures at least 20% more than private insurances.
Can I stop you just right for 1 second, Dr. Torres, and add a statistic? You're providing us a great illustration of a statistic that I heard some time back, and that's that the mortality rate for folks that have public insurance over private insurance is much higher. And we're hearing right now why that is, and that's because they can't get first-rate care because it's not covered. And so that's what we're going to be seeing, more of that, more people that aren't getting the care that they need because public insurance can't cover it. A taxpayer pocket isn't endless. And so the government is confined, and eventually they will have to make decisions that are rationing and that are based on cost effectiveness.
That's absolutely right. The mortality rate, not only the mortality rate, but the hospitalization state, the quality of care, complications, everything is worse in anything that is regulated by the government. And hospitals are aware of that. I don't say, please don't get me wrong, I don't say that anybody should have Medicare or Medicaid. Those are needed, but not the way they are doing it. And if you think that you're going to get better care with ObamaCare, having Medicare, think twice. Because ObamaCare cut Medicare coverage by more than $900 billion. You're not going to get better care when there is less money. And Medicaid is even worse. So that's exactly the case. And another thing that I want to tell you about the doctors, and this is my personal experience. When the government decides to cut the reimbursement for doctors across the country, it happens across the board, whether you were in private medicine or whether you were working in the hospital. The hospitals are big institutions. And the hospitals say, we're not going to close, although some hospitals close. So what the hospitals did was, the way we can survive is getting these private doctors to come to join us. And what happened was that you build your practice for 20, 30 years. You have all your patients. This is what you work for many, many years. This is what I work for. This is what I dream, coming to this country and practicing medicine and being a private doctor in my specialty. And then you are put in the corner where you have to make the decision. Maybe I have to join the practice because I cannot deal with this anymore. I cannot practice the way I want it because the government is between my patient and myself. So I sell my practice, or I move to another city, or maybe I retire. But no one of them is a good option. Many doctors decide to sell their practices. Here in Orlando, the 3 largest cardiology practices already sold. Now, who buys the practices? The hospital. And what happens when the hospital buys a practice? Remember, anything that is done in a hospital setting is more expensive. Anything. If you go to your private doctor and you need an EKG, he says, okay, we're going to do this EKG this day. It's going to cost you this amount of money. You go to a hospital, he says, you need an EKG. It's the same EKG. There's no difference. But will cost you this. So if you think that it's going to be cheaper, I can tell you because I see it every day. It's not cheaper at all. If you think you're going to keep your doctor, you won't. If doctors still believe that they're going to keep their patients, they're wrong. I lost all my patients, every single one of them. I left R&C. I am closing my office next month. I found something else to do, and I went through hell. When I call my friends in Latin America or friends that I know from different countries around the state, we have no words to describe this horrible socialized medicine that we're living. And don't think that it's free. Some patient has to pay 10% of the annual salary to cover ObamaCare. Even the Mayo Clinic in Arizona is refusing to see Medicare patients because a few years ago they lost $840 million in one single year. The Mayo Clinic. If an institution like the Mayo Clinic decides to do things like that and make such a decisions, what do you think a little Dr. Torres who has a one isolated small private practice might do. I start saying I have no words to describe this. This is the destruction of private medicine in the United States. Everything he said wasn't truth. And he was very well explained here. Very well explained. If somebody think that Obamacare is a solution to our problems in terms of health care, you have no idea what he's talking about.
We're definitely hearing today that Obamacare is not going to be a solution to our problems, but is in fact going to pile them upon. Thanks for telling us about how essentially we're creating more. The United States is supposed to be an oasis for folks from other countries that are being suppressed, and we're supposed to have embraced capitalism here. That's what's made our country so vibrant and so economically sound up until this point, and that's exactly what Obamacare thwarts with these regulations that he talked about, with increased taxes, and then with decreased reimbursements in the programs that they're already providing, that is making doctors like Dr. Torres go out of business. These doctors go out of business, well, somebody still has to care for people, so get in line, because you have less providers to provide the care that you need. You're going to have a longer line to get that care. Something that I hate doing. I was sick the other week, and I wanted to get an appointment right away. I don't want to wait. I mean, I'm sick. I need a care right now. I don't want to wait 2 weeks to see a primary care provider. But that's exactly what we're seeing happen. We're seeing especially primary care providers, family practice providers, these types of general practitioners are especially affected and are going out of business, I think, faster than a lot of other doctors. And not only are the folks that already have insurance and are already fighting for appointments are going to be fighting for less doctors, but the pool of people that have insurance, quote unquote, because we're going to have Medicaid offered to a lot more folks, is going to be bigger. So not only are you competing with the people that already have insurance and are in the marketplace, but more people, because the government, you, my friends, are going to be providing insurance to other people. So talk about camaraderie. That's exactly what we want, is to fight our neighbors for the appointments in small towns with doctors that we need. But I've really appreciated hearing the stories of these experts. But we want to make sure that we're able to answer some of your questions too. We have about 11 minutes left. Yes, ma'am, we have a question already in the back.
Try and speak up if you can.
Okay.
Very good.
All right. I received an email a while back, and I just wanted to check to make sure that it is true. They said you can actually, it's cheaper to not accept ObamaCare care and take the penalty. And my question to you is, they said that, those people are like super poor, that if you make $11,000 or less, you don't have to pay the tax. Is that true?
There is the question, let me just repeat the question, and that is it cheaper to pay the penalty rather than pay for insurance, first of all, and second of all, is there an exemption for people that make less than $11,000 a year?
I believe there is an exemption. I'm not sure if it's 11,000.
There is a poverty exemption. I'm not sure what the line is at either. But that sounds right. For some reason, I'm thinking between 11 and 14,000.
Yeah.
So.
And the second question, it is in fact much cheaper to just take the penalty rather than to purchase insurance. And so you're going to have a lot more people forego the insurance policy in favor of the penalty. That means a lot fewer clients for the insurance companies. That means what? The insurance company goes bankrupt and you have a single payer system.
But before it goes bankrupt, premiums go up.
Right.
So.
What that's called, the technical name for that is called adverse selection, which means that young, healthy people who would normally be paying into the system and help spread out the cost with all the other people that will be using the system, they're not going to get in. They're not going to be paying premiums. They're just going to pay the $700 penalty rather than pay their cost of buying health insurance.
So it's $700 a year, no matter what you buy?
It doesn't start out that way, but it gradually over the next couple of years increases to a $700 penalty.
one question about, one remark about your question is absolutely true, not only for big companies, but also for patients. I try to remember the name now, but there was a company here that put some numbers down, and they find out that if they pay everything Obamacare wanted to pay, it was about $2 billion a year. If they pay the penalty, it was $600,000. So that's, you know which one they decide to go.
Right, I saw this gentleman in the back. Your hand was up next.
Yeah, being a Christian who believes in private prophecy, I wanted to ask the panel what their take is on electronic identification. If we're going to have every man, woman, and child with a biometric ID or chip of some sort. I just want to know what your take is about it.
The question was whether or not any of the panelists have a position or a take on prophecy and whether that might be fulfilled by a biometric ID or some other form of identification that was associated with Obamacare.
I've not given that issue much thought. I mean, I think anything that gives the government the power to track you down easier than it already has is something that I would look at with distrust and disdain. But I've not given it much thought in terms of prophecy. I don't know if my colleagues have.
There's been no drive or directive to try and give somebody a sign or a chip or anything of that type that's been properly talked about. But there has been an enormous push towards electronic medical records under the impression that that's going to solve all of our cost problems. That if only we can put everybody's medical records down electronically, we'll all be able to share them and pass them around, amongst providers and whatnot. And really what that is to allow the government to audit and to check up on medical practices. And that's how they're going to keep track of you through the electronic medical record system. I don't see any personal sign or device that you would be required to have.
The advantage that I see using electronic medical records is that you can share that information with other doctors, which is okay, because many patients have different doctors. Actually, a Medicare patient, average Medicare patient, receives somewhere between 10 to 11 medications, sometimes from different specialties, cardiology, hematology, internal medicine, whatever. But that's one thing. You share information with other doctors for the benefit of the patient. The government has no business here. And I can guarantee you that any information that you share with the government, it will be used for a different purpose.
Yes, sir. We'll start over here and try and work our way over. If you can ask as quickly as possible.
Yes. Is there some site that discusses a lot of these answers and kind of like what we've been talking about that reveals this demonic plan, Obamacare, what it's really...
Okay, so the question is there a site that discusses some of the provisions? And actually, I'm really glad that you asked that, because I have a document in my hand right here that I put together right after this bill went through Congress, and actually one provision only is no longer relevant. And the document is called the Federal Healthcare Takeover of 2010. You can find that in Obamacare tab at lc.org. If you scroll down to the bottom of www.lc.org, you'll see an Obamacare link. You click that link and there's an image. Right above the image is this document. It has everything about how there are going to be caps on your FSAs, your flexible savings accounts, how health savings accounts can only be used in so many ways, how the government is creating a sort of militia. And it actually points you, we provide links to the two different bills that comprise Obamacare, and we point you to the section numbers. So we invite scrutiny, and I invite you to give this to your friends. I think it's an excellent way to say, hi friend, you don't believe that Obamacare is bad. Here are the direct provisions that are in the bill, and we provide you section numbers, so verify it yourself. Do you guys have other sources?
And while you're on the Liberty Counsel website looking at the Obamacare section, be sure to also sign up to receive our Liberty alerts if you're not receiving them, because that is how we are going to keep you apprised of the progress of our lawsuit. You're going to hear about it in the media, but we want you to know about it well before the media tells you, because we want you to be praying for us as we're making these arguments.
And tentatively, that date is May 17th through the 19th, I think, so just to keep that in your minds. Do you guys, gentlemen, have a website or anything?
The best source for economic data is to use the government's own numbers against them. In other words, if you're going to make arguments against this, the best place to go is get the numbers directly from the government themselves. And as I mentioned, there's the Medicare Trustees Report, the Alternative Scenario Report, and the Congressional Budget Office websites. All have a great deal of information there.
And probably the best source of information to find out about the consequences and implications of Obamacare is the Heritage Foundation. They divide it in different categories, like Obamacare impact on employees, Obamacare impact on doctors. There is one that says Obamacare impact on Hispanics, so I jump on that. There is another one, Obamacare impact on employers, and a lot of different things. So I think that you combine Liberty Counsel, the government source, and the Heritage Foundation, you can know anything you want to know about Obamacare. It will be there. I recommend to read it even when you might start crying.
Yeah, we actually work with Heritage Foundation, and funny that you mentioned that, and that Harry was mentioning the HHS regulations, because I saw an image that Heritage put out, I believe, and it was the stack of Obamacare, which Harry mentioned goes to right about here, but the HHS regulations that are the implementation regulations of Obamacare, 4 times that stack, and they just printed out the documentation. So as you can imagine, trying to find out what's in that, Nancy Pelosi, is a little bit more difficult even than finding out what's in the legislation. We have so much bureaucracy going on. Yes, sir.
Is immigration, or the effects of immigration, also affecting the health care in America?
Is immigration, or the effects of immigration, I'm assuming you're speaking of folks that are not
Illegal.
here.
Just the immigration in general and how the healthcare system interacts and works with that, because they do have to provide services. Are the costs of that also drastically affecting the overall situation?
I'm just going to say that in theory, we would think that somebody who's not a United States citizen would not be able to get United States health care. But that's not true. Anybody that shows up at a hospital with a condition has to be treated. And so as the number of immigrants, legal and illegal, increase into the country, people that are not able to pay for their health care become a burden upon the hospitals and the health care system. And where we see that having its worst impact is in the closure of emergency rooms. And there's been a huge number of emergency room closures at hospitals throughout the country who can no longer sustain being able to take care of these people.
There is a connection between those two. Remember, everything this administration does is connected. And there are a lot of illegals that are getting different benefits, health benefits. We see it in the ER, we see it all the time. And I think that California was trying to pass a law that where illegals can get health care. And I don't know if you heard that, but illegals now are getting food stamps now, especially if they don't speak English.
I think we have time for 2 more questions quickly. Yes, sir.
Yes, how's Obamacare going to affect VA and veterans?
The question is, how is Obamacare going to affect the VA and veterans? I think a bigger concern of veterans should be whether Obama decides to cut veteran benefits. I'm not sure exactly how the two are related. I know that there's a VA hospital and things like, my dad is military, so I know that he has access to care on a local base at the hospital there. And so I'm not sure that Obamacare has any greater or less effect on VA benefits than any other group of people, I guess. But I do advise you, if you're a retired military or if you get VA benefits, to watch what's coming down the pipe from Obama specifically on that, because his grand plan for cutting costs is actually cutting benefits to retirees, cutting health benefits actually of active duty military, while he increases benefits for same-sex partners of active duty military. So keep your eye out on that, because that's likely coming down the pipe in the next couple of years as well. Yes, sir, last question to the gentleman in the red shirt.
Okay, would you say that Obamacare has absolutely nothing to do with health care whatsoever? Would you say that the ultimate goal is to have all physicians working for hospitals that are controlled by the government, that are government employees, that will now be under the SEIU or SEIU?
So the question...
Controlled by the government, which would increase that. And as far as expense goes, expense would be reduced because of the fact that we're going to control birth or in control old age. Anybody that is a burden on the medical system will be eliminated.
Right, so the question is whether Obamacare is really about health care, or whether it's about government control, and whether it's about controlling costs by controlling life and not valuing life. Do any of you gentlemen want to have a go at that, Harry?
Well, I think I've made my opinion clear already. I believe wholeheartedly that the goal of Obamacare is to bankrupt the private insurance market so that you can have the government be in charge of your health care. And that is part of this philosophy that the government ought to be in charge of everything. Health care is one of those things.
And let's be honest, Obama hasn't really tried to hide that fact. You know, he's always been a fan of universal health care, and he's never really tried to hide that fact.
Obviously, had he proposed a single-payer system, government takeover outright, that I'd like to think would not have passed even the Democratic Congress. But he's a very shrewd politician, and this is just a vehicle that will get us there.
You're fighting this in the courts, and if the court's fine for you, who is going to hold that? The DOJ? So you're like wasting your time?
Well, I like to think the American people will not sit idly by and watch that happen. Yeah.
Well, I think that's all the time that we have. It's 3:03, and you guys only have a little bit of time to get back into the auditorium for the next session. But we'll be here for a few more minutes. If you have specific questions that you would like to come up and ask us, please feel free to do so. Thanks for coming out.
You guys for
We're glad that y'all came.